Welcome back to Have More Babies. We're here again to take, those really dense medical guides and pull out the absolute must-know information for you. Cutting through the noise, that's the goal. And today, we're tackling a big one, something that causes a lot of worry for parents. Neutropenia in children. We've got this really thorough guide, and our job today is basically to boil it down. What is this condition?
It's a
But the
punch.
low white blood cells,
Right.
right? And how that makes kids more open to infections.
Yeah, that's exactly it. And it's important work because hearing a term like neutropenia, it sounds scary, doesn't it?
It really does.
But understanding which part of the immune system we're talking about is key for managing things proactively. We're focusing on neutrophils, these specific white blood cells, kind of the frontline soldiers, and what happens when their numbers drop too low.
Okay, so let's start right there, the basics. What is neutropenia? If a parent is sitting in the doctor's office, what's the simple definition? And what are the numbers they should be listening for?
Right. So simply put, neutropenia just means you have an abnormally low number of these neutrophils circulating in the blood. And they're not just any white blood cell, they're super important, like the first responders for fighting off bacteria and fungi.
Bacteria and fungi specifically.
Primarily, yeah. So when you don't have enough of them, the body's defense against those common bugs is, well, weakened. Significantly sometimes.
Okay, so there's a normal range, and then there's the number that triggers the diagnosis.
Exactly. The numbers are crucial here. Normally, you'd expect to see neutrophil counts somewhere between, say, 1,500 and 8,000 cells per microliter of blood. It's a pretty wide range.
1,500 to 8,000. Got it.
Yeah. But the diagnosis of neutropenia happens when that count drops below 1,500. And if it goes below 500, that's usually considered severe neutropenia.
Wow, okay. So below 1,500 is the line. How do doctors actually find that number out?
It starts with a very common test, the complete blood count, or CBC. Most people have probably had one.
Right, just a standard blood draw.
Exactly. Quick blood draw, and it gives a snapshot of all the different cell levels in the blood right then, including neutrophils. That's usually how it's first picked up or confirmed.
But what if that CBC shows the number is low?
Yeah.
How does the doctor know if it's just like a temporary blip from a cold or something more serious, maybe a problem with making the cells? This seems like where it gets tricky.
That's the next step, definitely. Sorting out the why. If the count is really low or if it stays low over time, making it chronic, then yeah, doctors often need to dig deeper than just the CBC snapshot. The guide mentions a bone marrow aspiration.
Okay, bone marrow aspiration. That sounds intense.
It sounds more intimidating than it often is, but it's incredibly informative. Think of the CBC as checking the inventory on the store shelves.
Okay.
The bone marrow aspiration, or BMA, is like going to the factory where the inventory is made, the bone marrow, and checking production.
Ah, I see. So you're looking at the source.
Exactly. Is the factory damaged? Is there a blockage? Is it getting the wrong signals? The BMA helps figure out if it's a short-term supply issue or a fundamental problem with making neutrophils.
That makes sense. A factory check.
And sometimes, if the cause isn't immediately obvious, they might also use specific antibody tests. These can help rule out underlying things like certain viral infections, maybe mono, that are known to temporarily knock down the neutrophil count.
So you find the secondary cause, treat that, and maybe the neutrophils come back up.
Potentially, yes. Understanding this whole pathway from the initial CBC, maybe to the BMA, maybe antibody tests, it helps make sense of the process, doesn't it? It gives you a framework for what the doctors are doing.
Definitely less overwhelming if you know the steps. Okay, so we know what it is and how it's diagnosed. Now, the big question, why does it happen? The guide mentioned a whole range of causes, which was kind of surprising.
It really is a wide range. It's not just one thing, which is why the guide breaks it down into, I think it was 6 main categories. Knowing the category helps figure out the outlook. Is it temporary or is it something long-term?
Right, so what's the first category?
First up are congenital conditions. These are things a child is born with, often genetic problems affecting how those stem cells in the bone marrow grow into neutrophils. The guide specifically mentioned Kostman syndrome.
Is that common?
No, Kostman's is rare, thankfully. It's a severe inherited form, usually needs pretty intensive lifelong management. That's probably the one parents fear most, but it's not the typical cause.
Okay, good to know. What's next?
Second category is acquired or treatment-related. Think chemotherapy or radiation for cancer. That's probably the most common example here.
Right, because those treatments attack fast-growing cells.
Precisely. And bone marrow cells divide rapidly, so the treatments hit the cancer, but also, unfortunately, the healthy marrow cells. This causes a drop in neutrophils, but it's expected, monitored, and usually temporary.
So it's a known side effect, part of the treatment plan.
Exactly. Then third, there are medications. This one's important and sometimes missed. Certain drugs can actually trigger neutropenia, either by destroying neutrophils or stopping their production.
Which is why doctors always ask what meds you're on.
Absolutely. A sudden drop in count always warrants a thorough medication review. Fourth category is pretty straightforward. Infections.
Like viruses?
Yeah, certain viruses or even severe bacterial infections. Sometimes the body just uses up neutrophils really fast, fighting the infection faster than they can be replaced, or the infection itself might temporarily slow down the bone marrow, sort of like the system gets exhausted.
Okay, makes sense. What's number 5?
Number 5 includes the more serious primary bone marrow disorders, things like leukemia or myelodysplastic syndromes. Here, the factory itself is diseased, compromised by cancer or precancerous conditions, leading to a severe lack of healthy cells, including neutrophils.
That covers the really concerning systemic causes. But the sixth one you mentioned was different, right? More surprising.
Yeah, the sixth category is nutritional deficiencies. And this is like a powerful reminder of how basic body processes rely on the right ingredients.
You mean like vitamins?
Exactly. Specifically, a lack of vitamin B12 or folate.
Yeah.
These are crucial building blocks for cell division. Without enough, the bone marrow just can't produce healthy, mature neutrophils properly.
Wow, so just not enough B12 could cause this. The guide highlighted that, didn't it? That B12 deficiency can be kind of hidden.
It did. Because the symptoms of B12 deficiency may be fatigue, feeling generally unwell, they're so nonspecific in kids, easy to blame on other
All
things.
right.
So knowing that a simple vitamin deficiency could lead to a significant immune issue like neutropenia, it really changes how doctors might approach the diagnosis. Look for the simple stuff first.
Check the raw materials for the factory before assuming the factory itself is broken.
That's a great way to put it. Connects right back to the BMA idea.
Okay, let's switch gears to symptoms. If the main problem is being vulnerable to infections, what should parents actually be looking out for day to day? What does this look like in a child?
Well, the neutropenia itself doesn't have symptoms, right? It's silent. The symptoms come from the infections the body can't fight off effectively, so parents need to watch for patterns.
Patterns, okay. Like what?
The most obvious one is just frequent illnesses, loss of fevers, colds that just drag on forever, or infections popping up one after another, maybe needing antibiotics each time.
So it's not just getting sick, but how badly they get sick or how often.
Exactly, and how
Oh.
their body handles it, which leads to the second sign. Poor healing. Think minor cuts, scrapes, bug bites, things that should clear up quickly. In a child with neutropenia, they might take much longer to heal or even turn into ulcers because that first line of defense, the neutrophils, aren't there.
Okay, slow healing is a flag.
Definitely. And third, keep an eye on the mouth and throat. Things like persistent or really bad mouth sores, swollen or bleeding gums, or maybe a sore throat that keeps coming back. These can signal that the normal bacteria we all have in our mouths are starting to overgrow because the neutrophils aren't keeping them in check.
Right, signs in those mucous membrane areas. Got
Yeah.
it. So once it's diagnosed and hopefully the cause is figured out, what are the treatments? What tools do doctors have?
The treatment approach is pretty multifaceted. You've got ways to directly boost the neutrophil count, ways to protect against infection, and then fixing the underlying cause if possible.
Okay, boosting the count sounds important. How do they do that?
The main tool here is something called granulocyte colony stimulating factor, or GCSF. It's basically a synthetic hormone.
GCSF, what does it do?
It sends a powerful signal directly to the bone marrow of the factory, telling it to ramp up production of neutrophils, like make more, make them now.
Wow, how is that given? Is it a pill?
Usually it's an injection, sometimes daily, sometimes a few times a week, depending on how severe the neutropenia is. The goal is to push that neutrophil count up over that 1,500 danger line to provide protection. It's been a real game changer, especially for severe chronic cases.
Okay, GCSF for boosting production. What about protecting against infections while the count is low?
That's where prophylactic antibiotics often come in. Prophylactic means preventative.
So taking antibiotics even when there isn't an active infection.
Exactly. The idea is to prevent a serious bacterial infection from ever starting because the body might not be able to fight it off. It's like a temporary shield.
That makes sense. And what if the cause was, say, that B12 deficiency we talked about?
Well, that's the simplest fix, isn't it? If it's a nutritional deficiency like B12 or folate, then the treatment is nutritional intervention, targeted supplements. And often, once the body gets those building blocks back, the neutropenia reverses completely.
That's great.
And of course, if it's drug-induced, maybe you stop or change the medication. If it's chemo-related, you manage it until the marrow recovers after treatment. You treat the root cause.
Okay, so clinical treatments are one thing, but what about daily life? The guy talked about prevention, things parents can do. How do you balance keeping a child safe from infection without, making them live in a bubble?
That's a really crucial balance to strike, isn't it? The guide focuses on practical, high-impact areas. It's about being smart, not isolated.
So what are the key things?
First and foremost, strict hygiene. This is non-negotiable. Meticulous hand washing, using hand sanitizer, teaching the child good hygiene habits, and trying to avoid close contact with people who are obviously sick. It's the simplest, most effective defense.
Hand hygiene, number one.
Okay.
Second, dietary caution. This means being really careful with food, avoiding raw or undercooked meats, eggs, seafood, no unpasteurized dairy or juices. Basically, anything that carries a higher risk of bacterial contamination needs to be off the table.
Like no sushi, probably no rare steak.
Exactly. It's about reducing the load of bacteria the child might encounter, which honestly might be easier for a toddler's palate than an adult sometimes, but it's vital.
True. What's the third area? Third is environmental precautions. This is where the balance comes in. It doesn't mean staying indoors 24/7, but it does mean being sensible, like maybe avoiding big crowds during flu season, staying away from construction sites with lots of dust and potential mold spores, maybe skipping the indoor play place if there's a lot of coughing going around. It's about managing risk, not eliminating life experiences.
Right. Risk mitigation, not total isolation. That's a really important distinction for families. So the overall goal is managing the condition based on its cause and just being really vigilant about minimizing infection risk.
That sums it up perfectly. You understand the why congenital acquired deficiency, and that guides everything else from whether GCSF is needed to maybe just taking a vitamin supplement alongside those careful prevention strategies.
Well, this has been incredibly clarifying. That guide was dense, but breaking it down like this really helps. The word neutropenia might sound alarming at first, but now, hopefully, listeners feel like there's a clear map: the diagnosis, the potential causes, the ways to manage it. And here's something to think about, building on what we discussed. We know certain medications can cause this, right? So maybe the most critical question a parent can ask when their child gets a new prescription isn't just what are the side effects, but digging deeper. Does this drug require blood monitoring? Specifically, should we be checking neutrophil counts and how often? Asking that level of detail. That's real advocacy.
That's an excellent takeaway point. It shifts the parent's role from just receiving information to actively participating in the monitoring plan. Knowing the potential risks of any new medication and asking about the specific monitoring needed, that's putting all this knowledge into powerful action.
Absolutely. Now, for anyone listening who wants to see the full, detailed guide we referred to today or explore other related pediatric health topics, things like acute and preventive pediatric care, maybe you need info on lactation services, obesity medicine, or immunizations, we strongly recommend visiting omegapediatrics.com.
That's OMEGPEDIATRICS.com. Please do check it out.
And while you're at it, if you found this helpful, please take a second to like this video, subscribe to the channel so you don't miss future discussions, and share this with anyone you think might benefit from understanding neutropenia better.
Thanks so much for joining us today.
Yeah, thanks everyone. Goodbye.